So, let's discuss briefly who the heck I am. My name is Josiah Smith. Just real briefly, credentially, I'm a PA. Anyone familiar with PAs? Physician assistants? Anyone that is not? You're not?
I am.
Oh, you are? Excellent. Because I think we've been around a while now. I've been practicing medicine for about 19 plus years. And in my career, I've taken care of over 110,000 patients. That's a lot of people. It's called working too much. Okay? And one thing I have found in the conventional setting, and who would agree with this? When you go to see the doctor, you have a short period of time to see the doctor, and what do you usually leave with? Is it usually a prescription?
Yes.
Yeah.
Yes. Is that really solving the problem? No. May it help abate some of the symptoms? Yes. Is that necessarily a bad thing? Not necessarily. But there are a lot of other things with drug-to-drug interactions. But one thing I am most grateful for are my kids and my wife. So I have 4 kids, and as you can see there, 3 girls, pretty much all about the same age, and my son, and we enjoy the outdoors, and we are really excited because this summer we're going to spend a month in Italy. Traveling. Thank my wife for that. She's done all the planning, and she actually got another job so she could save for this. So thank you, wife. So let me make sure this is up and going here, and it's not. It's one last thing I have to do, and we will be good. So unfortunately, it is. Okay, we're good. So everything is going good. All right. Okay, so this is us.
Hi, I'm Dr. James Lefevre,
I'm Dr. David Light.
Josiah Smith, PA.
and we're here at Align Your Spine Chiropractic Wellness Center. Dr. Light and I are both chiropractors here, and Josiah is a new partner with us, and we are ALIGNOLOGY, a center for synergistic healing.
Now, this new dynamic in healthcare that we bring is the future of medicine. It's stem cell therapy and functional medicine. It gets to the root cause with the functional aspect, and it reverses chronic disease conditions. This is the future of medicine.
We invite you to learn more about stem cells and how it can change your life. For more information, you can check out our weekly workshops, information below this video.
See you guys. Have a great one.
Take
Thanks.
care.
Bye. Yeah, is that what caught your attention on the Facebook ad? Isn't that amazing how that draws the community? When you have a problem, it speaks to that problem. That's why you're all here. Who here is a support person? Someone that's in pain.
No, he's in pain. No.
No, you're a support person here with him. Now, we are going to discuss the purpose. My greater purpose and my team's greater purpose is to end chronic disease and pain with stem cell therapy. And we're going to discuss that. And I have a promise for you that at the end of our workshop today, you're going to learn how you can reclaim your health without the use of drugs or surgery. Now, would it be okay at the end, as you're learning today, to learn about our program, what we have to offer? Can I see a show of hands if you'd be interested? And would that be okay? Yeah, absolutely. Because it's good to at least get information to see what's available outside of drugs and surgery. So, and that's the opportunity there.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness.
Well, these are our friends across the border. This coincides here in the U.S. Who here is concerned the last 10 years, even 20, 30 years of their life, will be in pain and suffering? Is anyone concerned about that? Yeah, a lot of us are, aren't we? And do you think the current system we're in is helping that at all? No? Is it frustrating? It's very frustrating, isn't it? I'm going to give you, 6 years ago, I was working an urgent care shift, and I got a phone call from my mother panicking. My father had a massive heart attack. They were living up just outside of Salt Lake City. So I left work and drove up there. And, knowing your son, being a son, my father, having a massive heart attack, that's, you don't know. A lot of people don't survive heart attacks. So I remember being outside the operating room. He actually pulled through. But I was examining his life because in the current system, my father required drugs and surgery. He has an advanced autoimmune condition called ankylosing spondylitis. So at an early age, he has suffered. He's had, in his early 30s, both hips replaced, a knee replaced. He's had prostate cancer, melanoma. The autoimmune condition has affected his breathing. He's had to be on oxygen. So this man has suffered. He's 78, probably a good 40 years of his life, especially the last 20. And I asked myself, what can we do differently for him? And that was a big frustration of mine. And that really got me thinking over the last couple of years, there has to be other opportunities outside of the conventional system with addressing a disease state, which is a name we give, with what? A drug? Or surgery. That's how the conventional system is. How is it set up? For me, and what I'm seeing on the inside, it's like a triangle. We have the pharmaceutical company, big insurance, and the government. There's nothing wrong with making money. That's what makes the world go round. But it is monopolized. Do we think we have sick care or health care in this country? Sick care, managing this. And it is a problem here in the U.S. And there's a little video I want to show. It's called Escape Fire. It's actually a movie. It hits this perfectly. But I think it's very important to watch it. It's about 2 minutes. So this is the healthcare crisis here in the U.S.
The American healthcare system is badly broken.
The present system doesn't work, and it's going to take us down. We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spend 5 minutes with you and then put in one of these stents, I probably get paid $1,500. For me to spend 45 minutes with a patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
We're seeing the military just being a microcosm of the problems society's having.
Soldiers' use of prescription drugs has tripled in the past 5 years.
Medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical, so skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
The healthcare system is unsustainable. We're really mortgaging the future. Not just the health of healthcare, we're talking about the health of the nation.
Does anyone see this actually happening in this country right now?
Oh, yeah.
Yeah? Is it scary?
Oh, yeah.
It's very scary, not only from a financial standpoint, but how about your health? If you don't have your health, what do you have? Nothing at all. And how do we prioritize our health? Do we? We do with what we know. It's going to the doctor. You know, medical school, we're taught nothing about, let's discuss this, what to prescribe, how to diagnose, treat, put you in a little box, read, interpret lab tests, x-rays, imaging studies. But for chronic disease, ultimately, what does it take to actually get better? It's lifestyle based. Would you agree with that? The food you put in your body, food is medicine. Who thinks eating healthy affects everything that goes on in your body? Absolutely. How about sleep? Who here is sleep deprived, has a hard time sleeping? How does that affect your life? Crabby in the morning, can't function. Where did you put the car keys? You know, your relationships, your energy level, all of that. Proper healthy movement. Mindset. Do we believe we're under a lot of stress right now? Oh, yeah. Chronic low-grade stress. It's everywhere. So here's how the U.S. ranks. We rank 37th in industrialized nations for health outcomes. Number 50 for health span, how long we're going to live. What's even scarier is our children's lifespan. My children, some of your grandchildren in here, is going to be less. For the first time in modern history, we have twice the expenditure. And if you're retired, they're estimating a couple that's retired on government assistance will spend $250,000+ on care during their retirement. $250,000. For most people, that's more than their savings. And chronic disease knows on the rise. Okay, who thinks we are due for a change? Do you think we need a change? Do you think it's going to happen at the government level? No. You are each here today, and I commend you for making the time to come here, because this is a grassroots effort. Because today you're going to learn some powerful information, and you can decide what you want to do with it, how it may change your life. If you can get and reclaim your health, how much better are you going to be in living to your highest potential? If you're always worrying about the next pill, the ache, the pain, that's not a way to live. Now we talk about the golden years. What's so golden about the golden years? Who's living the golden years? No. No, let's make that quality of the golden years be quality, not in pain and worried about where your next ache or pain or pill is, or doctor's appointment. Listen, the medical system has its place. It's good at emergencies. It saved my father. He's basically Robot Man put back together because the medical system has kept him alive. But his quality of life sucks. And I see that. And I don't want that for myself or my children or the future generations. But yet alone, those of you that are living today, we want to make it better for you now, not tomorrow, now. So the new approach. How about actually optimizing your body? Do you think it may be a better solution if we actually use the body's natural ability to heal, as opposed to giving you an artificial prescription? Yeah, it's a starting place. We know the third leading cause of death is iatrogenic, medical errors. My profession kills people that we take care of. Third leading cause of death. The Hippocratic Oath we take in medical school, first, do no harm. So when we talk about functional medicine, I'm just going to go over this very quick so we can focus on why you're here today, is getting out of pain and addressing what stem cell therapy is. And that is functional medicine. So look at where your current state of health is now. Where are you right now? Okay? The smallest unit is the cell. What are things that affect things at a cell level? Okay, energy. The food you eat that turns the mitochondrial energy so you can function. We have detoxification. Who thinks here we live in a very toxic world? The food we eat, chemicals that are sprayed, herbicides, pesticides, clothing, and things that we do. Stress, brain health. That's another issue. This affects everything at the cell level. Diet and digestion, what you're putting in your body, what's going on in your gut. Stress, inflammation, hormones, and finally, lifestyle environment. If we have positive signals to the cell, it's only going to improve the organ health, the heart, the lungs, the kidneys. And ultimately, if the organs are healthy, Your systemic health is going to be healthy. And then your state of health is going to be healthy. Do you think it's a better way of looking at it from a cell level up? Now take the opposite. If all of these things that affect cell health are negative, do you think you're going to have overall good health? So positive effects at the cell create a global improvement in overall health. But now, the cool thing that we add to this is the regenerative component. Who here has heard of stem cells before? Who here even thought this was a stem cell workshop? That didn't say anything of advertising, did it? No. Pick your curiosity there. Who here has heard of stem cells? Who here has no idea what stem cells are? Well, great. This is going to be a new learning for each and every one of you. This is the most current cutting-edge medicine. But the cool thing is, it's not a drug. It's natural. It's what our own body can do. So let's talk about some health outcomes. Now, we are associated with, as you see down here, stem cell health centers. We are actually working with a group out in Utah called East West, but their group is Stem Cell Health Centers with Go Wellness. And we are on our journey working with them so we can give a broader reach of any chronic disease and pain with people. So let's just discuss, first of all, some stem cell therapy outcomes. So far at this point, over 2,100 procedures have been performed, and over 1,000 of those have been with knee pain. So who here is for knee pain again? Yeah, that's what kind of brought in from the advertisement for Facebook, right? Yeah, that does a good job. So, but knee pain, we probably have some of the best success with knees. This is the bread and the butter. And we talk about success rates. Not everyone is going to be successful for this, but we're finding within 6 to 8 months, there's about a 94% success rate. And we have prevented over 415 knee replacements. And keep that number in your brain as we go through some forward slides. We've also done over 1,000 brain regeneration, hips, shoulders, neck, lumbar spine, elbow, tendonitis, TMJ, neuropathy, with an overall improvement 72% at 3 months and 95% at 6. Now here are some unique stem cell therapies. We have 25 years of non-Parkinson tremors. You know, Parkinson's is a neurological degenerative disease, which is ultimately, you're going to die from this. And by the stem cell therapy, there's been significant improvement in the tremors. We also have macular degeneration, blindness, one of the leading causes of blindness. This can be helped too and reversed. Rheumatoid arthritis, a very inflammatory autoimmune condition which affects every part of the body. Significant improvement. And we're going to see a case study of an actual patient. His name is Ron, who this person actually is. So he had 85% improvement in 45 days, 95% 1 year. Diabetic non-healing ulcers. We find that this is antimicrobial, so it actually helps regenerate tissue. COPD and asthma. And the oldest patient that has been seen was 96 years of age. So do any of you think you're too old for stem cell therapy? Can you beat 96? Anyone here older than 96? No? Who wants to live to 96? Okay, well here's the question. If you want to live, what's your quality of life going to be then? That's the thing. Your golden years. Let's make them platinum. Yeah, I think that's a step up. So what exactly is a stem cell? A stem cell is a master cell, when we're born, that can turn into 220 different types of tissue and organs. So it's a precursor cell that can actually transform into all these and replicate itself. Now, who here has heard of Dolly the Lamb? Embryonic stem cells, 1995, Scottish advancements. This is not what we're talking about. That's cloning. Okay, the mother. And what happened to Dolly after 2 years of age? Very sick, cancer, died. Because embryonic cells want to be a baby, okay? And they differentiate. You don't know what direction they're going to go in. So just so you know, this is not what we're talking about. I'd be in prison right now if we were doing this. What we're doing here is legal, and there are a lot of other people doing this, but we're going to discuss the difference, what we do compared to other people. So types of stem cells. So we know we're going to talk about a couple different types of stem cells. So every part of the body has a stem cell. But what we're finding therapeutically, there are adult stem cells. You can use your own bone marrow or fat, and we'll discuss that. And embryonic, which is illegal. And what we are using, we're using placentas.
Oh, yeah.
Postnatal.
Heard of that,
Yeah, and we'll discuss that. That sounds kind of gross, doesn't it? Using someone else's stem cells and what's in there to help reverse disease. So first of all, these mothers that are used are screened. So the last month before they are going to have a scheduled C-section, the OB says, hey, what do you want to do with the birth waste? Because in America, there are 4 million placentas that are put out to trash. They are incinerated. But there's so much healing potential here. So these mothers are screened themselves. And then on the day of the C-section, the company we actually use, there's actually a technician that knows the time of the scheduled C-section. And when the baby is born, he collects the placenta, drains all the blood, and it's back at the lab, fresh and harvested within 10 minutes. That's how close it is. So this doesn't get any better than that. And it's also the lab that we do use that processes all this is actually the Food and Drug Administration, follows very strict guidelines for this. So let's talk about adipose. Who here has a little extra fat around the center they want to get rid of? Anybody? Can we all lose a little bit right around here? And who wants that six-pack? Yeah. Well, adipose can be used. So there's actually a high quantity of stem cells and fat. But where are toxins stored? Something called lipophilic, which means fat-loving. A lot of chemicals are stored in fat cells. And as we age, the quantity and quality decline. So they actually, to get them, they have to soak them and put them through enzymes. But this actually works very, very well. But when you get older, do you think the quality and quantity decline? Absolutely. And you can actually bank your own fat cells for later use. So this is one option. It's a minimally invasive procedure. One that has been around probably the longest is bone marrow. So they actually take a large bore needle and usually may put it in the hip or the leg. No, and that's usually done, someone that's usually orthopedic trained. And the nice thing about this, it has been shown to have FDA approval for curing leukemia, lymphomas. And they actually use this for degenerative disease in, say, like the joints too. So there are a lot of people that do this, but this is a little bit more invasive. So when we're talking about the quantity, we can see here, this is 1 ml of actually cord tissue. There are 3 million mesenchymal stem cells compared to bone marrow, aspirate, there's only 1,600. So there's a quantity difference with what you're getting. And mesenchymal stem cells is what we're going to call them. The stem cells actually decline with age. So do you know why a baby grows so quickly? It has to be the turnover of the stem cells. If a baby falls and hurts themselves, compared to, say, one of us that falls down the stairs, who's going to get up and maybe cry a little bit? The baby. What happens to us when we fall down the stairs?
Break something.
You break something. So there's a huge differentiation. So the newborn, out of every 1,000 cells, there's 1 stem cell. And by age 50, it's 1 in 400,000. By age 80, 1 in 2 million. So it actually declines. And something else too, there's something called the doubling time. Why younger people heal so quickly is because they doubled the timing. So for every 28 hours, within 1 month, 1 billion stem cells in a baby. Number 12. Anyone know who this is?
Not that.
Tom Brady. Yeah, he's about 40 years of age.
Oh, I didn't see that.
Yeah, New England Patriots. Okay. So I'm a Patriots fan, living in Vegas, but that's all good, right? So he's 40. So 1 cell will double every 48 hours. In a month, 32,000 cells. By the time you get to grandma's age, 65 plus, it's 1 cell every 60 hours. If you do the math, it's only 200 cells. So this is why as we age, we don't heal as well. And what exactly is aging? It's a balance of regeneration to degeneration. If the degeneration exceeds the regeneration, guess what? You're not going to heal as quick. That's the aging process. My goal is to live to be 156. Quality of life. Why? Because of this and other things that I'm doing. Why not? So this is a very important differentiation which is not talked about if you learn about stem cells. They can actually be grown in a petri dish and expanded. That is illegal for clinical application here in the U.S. This is done in research facilities, large institutes here in the U.S. and abroad. So you can actually go to Panama, spend a lot more money. They'll actually expand the cells and re-inject them. And marvelous, marvelous things happen. But it's done in the petri dish. And the stem cells that they can actually expand and grow from almost anything. You can get neuronal stem cells for brain, enterocytes, intestinal, hepatocytes, liver, cardiac for the heart, osteocytes for the bone. And I have actually had some in vitro stem cells done. These are my twin daughters. So this is actually a form of stem cells. And this is, I got two beautiful twins out of it. Okay? And this is interesting. My son, who's 14 now, was in vitro, successful. We tried a second time, unsuccessful. So we're able to harvest 10 of the eggs and cryopreserve them for 2.5 years when we're living in Michigan. And then when we're ready to try again, we have them shipped here to our infertility specialist. My wife was really concerned that our children would get lost in the mail. Can you imagine that? They did it. Here they are. So that's a form of stem cell. That's almost embryonic though. But then again, as I said, outside of this, it's illegal. Now, when they're actually put in the body, they do not duplicate and replicate themselves. And this is very important to understand. They act completely differently when therapy is put in, whether it's from bone marrow, adipose, or if we get it from allogeneic, from the same species injected in, which is usually what we're using as the placenta, the cord blood, the amniotic fluid, and tissue. So it does not expand and duplicate itself. So, how does this work? How does this work? Is it like the hand of God coming down and just magically happens? We hear harp music. You think it happens that way? Maybe? Well, when we talk about stem cells, it's more than stem cell therapy, folks. There is so much more than that. That's actually, we're finding out that's only a small component. There are growth factors, cytokines, protein-rich plasma, enzymes, there's collagen substrates. These actually create an environment for your body to heal. So what happens when this therapy is introduced, whether it's in a joint, intravascular, and we're finding novel ways to cross the blood-brain barrier for neurodegeneration, it actually goes to the site that is problematic. So those sites that are problematic bring up an SOS flag and they say, come over here. So they know where to go. So they go to those areas that are problematic. And they're usually with capillaries and blood vessels. And they actually recruit your body's own natural ability to heal, which is pretty cool. So this is what we know when it's in the body. We call them medicinal signaling cells because they act as a signaling agent. They control inflammation. Biliary pain, degenerative joint disease, torn cartilages. That's inflammation. Disease and aging is inflammation. Anyone here have an autoimmune condition? Well, no one here. It's surprising because we're seeing an uprise of autoimmune conditions, especially with the female population. It modulates that. It stimulates regeneration. So it actually hooks up the dying cells and donates mitochondria to dying cells. That cells do die. We have 300 million cells that die every single minute. As I said, if the cells are dying quicker than they can regenerate, that's the aging process. That's the degeneration and disease. It's also antimicrobial and reduces scarring. So we're going to go into some applications, and see in red, knee pain, arthritis. So a lot of you are here for that today, and we're going to get into that specifically. But I think it's important to at least have a general knowledge. We're not asking any of you to be here PhDs today, but we just want to give you some basic information of what this is. Okay, if anyone tells you they're doing direct stem cell therapy, it's more than that. It's what's in there. It's the milieu. It's the entourage effect, which means everything in there is more powerful than just one thing. Does that make sense? So all these different things they can help with. It just goes on and on and on. So how many of you here today have been putting off pain and suffering for too long? Yeah, a lot of you here? Yeah, we know it's affected your life. Relationships. We hate seeing people in pain. I'll tell you, if I don't get a good night's sleep and I tweak my back working out, my wife says, you can go sleep down on the couch. Ability to work. This can affect income directly. If you can't get up and go to work, and it requires even just getting up and down and doing a little bit of ambulation, that can be problematic too. And overall, to enjoy life. Okay, so when stem cells are injected, how do you know they know where they're supposed to go? So they actually have FDA-approved 99 MTC administration IV, which actually tags the stem cells. Okay, as we can see here, right hand osteoarthritis. This person also has diabetes. What organs does that affect?
Liver, kidneys, everything.
It can affect everything, yes, but primarily, initially, it's the pancreas and the liver. And you can see there's some areas where it's affected here along with the lungs. So more specifically, osteoarthritis right hand, nothing in the left hand. So we know it goes to the site of where the problem is. It just intuitively knows. That's how beautiful the body is. This is why utilizing what God has given us to heal is so much more powerful, oftentimes, than drugs. Okay, here's some stem cell treatment application. We have a 6-month non-healing wound from a laser treatment. And we have finally 6 and 8 weeks later. So this is regenerative and antimicrobial.
Boy, I need that.
Yeah. Who here is going bald and needs a couple extra hair follicles? Okay, this is alopecia, so it's been used for regenerating hair growth. Remember, stem cells here. Who needs to get rid of some wrinkles? Yeah. This is an alternative to Botox, and they found this to actually work better and last longer, significantly longer. So there's actually cosmetic application to this too. When stem cells have been injected for individuals that have had a myocardial infarction, congestive heart failure, arrhythmias, has actually been shown to improve upon it or reverse it. Alzheimer's and dementia. Who's here is concerned that they may have, or may be getting at some point, Alzheimer's?
Oh, I hear.
Losing the brain. Yeah, that can be problematic too. It's called type 3 diabetes. It's the inability to process insulin in the brain. Parkinson's. Here's another thing that's on the rise too. And they've actually found with acupuncture, stroke, and stem cells, so this is the, I'm not going to call it the alternative medicine, but another modality that is used, it actually allows the blood flow and the stem cells to go where it needs to go, and it actually helps with the migration and differentiation of the stem cells within the brain and improvement upon those symptoms that stroke patients have. Also with potential lung problems. Who here knows people that have had COPD, advanced asthma, oxygen therapy? Okay. How does that affect your life? Huff and puff, yeah, there you go. So let's hear Dwayne's story.
All right, you ready?
I'm good.
Hi, everybody. My name's Dwayne Johansson. I just come back to East West Medical for a booster shot about 8 or 9 weeks ago. We came to a seminar here, and immediately my wife looked at me and I looked at her, and she said, let's go for it. So I had a stem cell injection the very next day. On the way home from here, I got a blood clot in my left lung, or in my right lung, excuse me. And so I got sick. And I stayed sick for the next 6 or 8 weeks. But once I started feeling better, I started improving. My lungs started working. In fact, I was to my respiratory specialist just the other day, and he said to me, Dwayne, this is the first time in over 3 years that you've actually been moving air. He said, I can hear the air moving in your lungs now, and I haven't heard that noise for over 3 years. And he's a good doctor. So he looked at me very amazed. He says, I don't know what's going on, and I know this. I've got 3 things to look at. My grandchildren praying for me. I've lost a little weight, which I'm sure has helped. And then the stem cells. I've got about 8 or just after Easter this year. And I'm confident enough in myself and in the procedure to know that these are helping me. So I'm just telling this young lady about it, and she asked me if she could video it, and I teased her about compensation, but I actually want people to know that I firmly believe that the stem cells are working in me, and I'm here to get a booster shot today. So I'm going to come back in another 6 or 8 weeks and let them know how this one turns out. But I'm 100%, just because I know in my heart that this procedure has helped me a lot, and I hope to help somebody else, get off the fence and get it done. It's worth every dime of it to me, and what do you got to lose? Give it a shot. That's
Yeah, pretty cool. It's not a cure-all, it's not a panacea, but if you can improve quality of life, how important is that?
Really,
if you've been sick, and we talk about degeneration. With your degeneration, your life, it just gets worse and worse and worse. But if we can regenerate, we can actually improve upon your quality of life. And for a lot of people, that is, an amazing thing. Advanced osteoarthritis, rheumatoid arthritis in the hands and the body.
Don, tell me.
Yeah, so this is Don. I'm going to tell you a little bit about his story briefly. He has advanced rheumatoid arthritis. He was on 16 medications. His kidneys were failing and his liver were failing. 5 specialists were in the same room when he was hospitalized. And they had to come up with another option for him. And guess what that other option was? Medication number 17. Do you know what he did to each one of those doctors? You're fired, you're fired, and you're fired. He found out about stem cell therapy, and he's this rheumatoid patient that we heard about at the beginning, where within a year, he's about 90-95% improved and off pretty much all of his medications. Isn't that amazing? But it took some time and working with the doctors to gradually reduce it, and the medical team that was working with him on the therapy. Okay? So let's hear his story.
So Don, tell me about some of the symptoms you were experiencing before getting stem cells.
Extreme arthritis, swollen joints, swollen artificial knees, back, shoulders, elbow, excuse me, and then I came in east-west acupuncture for the stem cell injections in November and October, and the results from that was no longer having to use Embro or Humira. Pain meds, Lortabs decreased dramatically, and no further pain medication other than occasional Lortab or other broken ailments. And it's been fantastic. Swelling is all gone, No flares, none serious. If there were any, it's not that I know of.
And on a level of 1 to 10, how would you rate your rheumatoid arthritis before the stem cells?
I'd rate it at about an 8 or 9.
And how would you rate it now?
About a 1 or 2.
Awesome.
Isn't that pretty amazing? Pain scale 8 or 9. Who here has a pain scale greater than 6 or 7? Wow, that's a lot of you. When is it if we get this down to maybe 1, 2, or 3? Would that improve your quality of life? We can see this here firsthand. Because remember, this is anti-inflammatory. Get the inflammation down. If you're overly inflamed, it will help with the pain. Sciatic regeneration. Who here has heard if you sever your sciatic nerve, you can never regenerate it? Spinal cord injuries. Yeah, well, the science is progressing to the point where they're actually regenerating. Spinal cord injuries, for those that may be quadriplegic, paraplegic, and even with sciatica regeneration. So this was an interesting study of 1,700 rats. They severed the sciatic nerve, and they injected umbilical cord human stem cells into the rats, and they tagged them. Almost every single rat regenerated the sciatic nerve. And this is very interesting to know. When they went to go and look at what type of stem cells they were they the rats or the umbilical cord human? They were the rats. So the body does amazing things. So there is no rejection. We know there's something called host graft rejection. Those people that may have had an organ transplant, you are on prednisone, anti-rejection medication. And there's actually a clinical indication using umbilical cord blood to save that organ so it doesn't get rejected. So we know how amazing this is. Surrogate mothers. You have a husband and wife that have implanted the beginnings of a baby in a surrogate mother. Yet no relationship, no reaction, but can go to term. Isn't that amazing? So we can see with the bulging disc, before, you see it's bulging, it's actually improved. And this is interesting. In the New Yorker 2012, a fact that patients with spinal cord surgery, 72% of them needed a redo. Wow. Surgery does not guarantee success. And a redo doesn't sound so exciting, does it? Who here has had surgery before? Okay. Have any of you needed a redo at all? A redo? Okay. Okay. It's not fun, is it? No, not at all. Now, yeah, and also spinal cord injury. Again, we're finding increasing improvement, not completely healing, but improvement in motor function, bladder control, breathing for those that have spinal cord injuries. And again, knee pain, this is what you're here for, right? Now let's talk about knees. Now we're going to get into the nitty-gritty. We're almost done, guys. So, normal joint spacing. It's not bone and bone. You see here? Bone and bone, more
That's
so.
Brian.
Right? Bone and bone. Okay. Okay. So there are 4 stages of osteoarthritis when we talk about knees. Stage 1, there's very minimal disruption. Probably not have any symptoms. Stage 2, you start having some joint space narrowing. You may have some good days and bad days, depending on the weather. Stage 3, yeah, it takes a little bit longer. You may be popping that ibuprofen a little bit more. And stage 4, you're usually going to go see the orthopedist, and you know what the orthopedist is going to tell you? Total knee replacement. Absolutely. So let's talk about some common modalities. And I do a lot of these. I mean, my urgent care practice, I do a lot of cortisone injections. So first of all, you start with non-steroidal anti-inflammatories, Motrin, Advil, Mobic, whatever it may be. But 44,000 people die every single year secondary to non-steroidal use. Okay? My father, when I was 1 year of age, because of his ankylosing spondylitis, was taking aspirin. He had a massive hemorrhaging bleed in his GI tract. I almost lost my father and didn't even know him early on. So he was almost a number and a victim of modern therapies. Now, cortisone injection. Who here has had a cortisone injection? We know Lynn has. Okay, everyone here has. Has it provided maybe some relief for some people? Oh, absolutely, it can. Was it always long lasting? No. But what's the most you can get in 1 year? Usually 3. And here's the reason. 8% within a couple months you lose the bone mineralization. It just puts you that much closer to what? Knee replacement. Winner over here in the corner. Good answer, good answer. And corticosteroids are very powerful anti-inflammatories. They suppress your immune system. They say it goes local, but it can go systemic. And those with breathing issues, the corticosteroids you use for breathing, problematic. Intranasal corticosteroids for seasonal allergies. Long-term can be problematic too. It provides relief, but we have to look at the long-term consequences. And it also increases blood sugar, so if you think you're diabetic, now you may be because of the cortisone injection. It also causes and potentiates potential blindness too. Is that worth it? No. But I still give shots because that's what people want. Okay? But that's conventional though. That's conventional. Okay. Common treatments for surgery. So this is a knee surgery. Healing time, if you're lucky, 3 to 6 months. If you're lucky, if you don't need a redo, there's no guarantees of this with redos. High percentage of failure and complications. And with those failures and complications, when you sign the waiver for the surgery, you have to look at the fine print. 1 in 400 people die from a major surgery. You don't want to be a statistic. 1 in 200 blood clots or secondary infection and reduce. Is that worth it? I mean, those stats for me, I mean, is it needed? Yes. My father-in-law just had a total knee replacement about 6 weeks ago. He's doing a lot better. But he said, next knee, I'm going to go see you. From that end. And cost. Who is this costing? Is it costing us, the insurance, society as a whole? Everybody. $57,000 on average. That does not include redos, therapy, co-insurance. The group we work with, 1,000 knee injections for stem cells. They save 415 people from knee surgeries. If you multiply that times 57,000, that's almost $24 million saved. That's a lot of money for just a small number of people. Can you imagine if we got more people to understand, or even insurance to cover this at some point? Because right now, who thinks stem cell therapy is a covered benefit under your insurance plan? It is not. Why? Because the pharmaceutical company cannot make money out of it. They cannot make a synthetic. They cannot patent Mother Nature, our own innate, God-given right, what's in our body. So I think they will be waking up sooner than later and realizing that there has to be a transfer of finances at some point for that to happen. Okay, this is post-surgery. Puffy knee. I want to see before, after, there's improvement. The blue, bone and bone. After, there's cartilage regrowth. Before, after. And there's also not a lot of money being put into these studies. In the last year, there's been an increase of over, probably, I think about 5,700 research studies going on with stem cells worldwide right now. So there's been an explosion in the last 18 months. These people are now, in the medical community and the science community, is realizing what the awesome potential is for this. And this is a small research study. They followed 6 patients over a period of 7 years. Small study, but outcomes. They actually found it's the first in human trial investigating stem cell-based medicinal products, allogeneic umbilical cord blood, which is what we use with hyaluronic acid. And they found the clinical outcomes were improved and stable, and no significant adverse events were observed over a 7-year follow-up. Small study, but we're seeing success, and those outcomes are being documented now, even if they are a small study. Isn't this positive?
Oh, yeah.
I mean, granted, it's not 10,000 people, but it takes a drug company $1 billion to get a product to market. $1 billion. There's not money in this, or that amount of money to do the research. Tom Brady again. Sorry, guys. I love my quarterback. Look at all the injuries he's had. Knee, 17. Right shoulder, but that's his passing arm. This man is a miracle when it comes to football, because most people's career ends 10 years before his did. He's 40. Okay? He's not had stem cells yet. But I'll be knocking on his door one of these times, because there have been a lot of professional athletes that have had stem cell therapy. But he's taken very good care of his body. Proper nutrition, mindset, relaxation, sleep, all those important things that create an environment for the body to heal. And, oh, talking about football, look at this guy's knee. Ouch! Yikes. We're talking knees today, right?
Yeah.
Talking knees today. So, the Andrew Institute did an actual study on stem cells in NFL players. They did 31 NFL players over 10 months. They found a 45% reduction in pain. And knee scores improved by 50% from baseline. This guy right here may have taken a little longer though.
Hi, I'm
Oh, and this is Charlene, and she had stem cell therapy done on her knee. So let's listen to her.
Hi, I am Charlene, and I had a knee scope, and they had taken most of my meniscus out, and so I was basically bone on bone, and they had warned me that in a couple of years that I would have to have a total knee replacement. I didn't want a total knee replacement at all, and I was getting in so much pain that I decided to check out stem cell, and I came across an ad of East West Health having a seminar, so I came in and immediately decided that's what I wanted. And I went in and had an evaluation, and they agreed that they could help me. And I had stem cell on my knee, and it has been wonderful. I haven't had the pain that I had before I went in and had the stem cell injected, and I have been so grateful that I have done it. And I would encourage anyone that's having problems with their knees or their joints of any kind that they come in and talk to them, because I think they would be able to help you.
Yeah, so isn't it nice seeing clinical outcomes from actual live patients that have had this done?
Oh yeah.
No, it's nice that the science is there. It's there. It's in its infancy. Like anything that's new, it's in the infancy. But why do we have to wait 10 years from now to take advantage of what is safe and effective today? There are no adverse reactions with this. There have not been any that have been reported. And over 300,000 procedures have been done worldwide, both with bone marrow, adipose, and umbilical cord.